Okay, my name is Brad Wilson. I'm the president of Missionary Ventures Canada, and right now we are here with Natalie Reed, who is the founder of this ministry called Chance in Montego Bay, Jamaica. And we have been here this is our second day, just spending time with clients and getting to know Natalie and her ministry here. And Natalie, why don't you share with us a little bit about the startup of why you started up this ministry here and what it's all about and so on, if you can explain that for us.
Sure. I started Chance Rehabilitation Center Emily's House in 2010, and the reason being is the mental health, the stigma and the status on mental health, it's really, really poor. And I know this is a tourist area of the Western region, and we have the highest amount of homelessness. And usually there's a correlation between homelessness and mental health. So I've been searching for a center. I keep hearing on the radio and on the television that we need a center for these people when they get out of the hospital, when they get out of jail. And I'm thinking, well, that's continued care, and that's what they would need. We're the first center in the Western region of Jamaica to have an establishment as this. And our goal and our aim is to transition persons after they've reached a level of stabilization, to transition them back into society, both healthy and financially. We want to help them to place them in jobs after the stabilization process has started and it's gone into a far way. So we're a long-term care center, and we have about an 85% success rate. All of our clients go back into society doing well, either going back to academic studies or being gainfully employed. So it is a faith-driven mission, and I love what I'm doing, and yeah, pretty much.
Now, in our conversation earlier, you shared a little bit of your own personal history. Mm-hmm. Just wondering if you would be willing just to share a little bit of your story, because that connects so well with what you are doing here and your vision and your passion, because you have gone through things in your own life. Just wondering if you could share it just briefly in regards to that.
Sure, no problem. In 2006, my stepson had killed 6 of the family members. And I had to raise Jesse. And basically what had happened with Jesse, he was clinical. After the incident, he was clinically diagnosed with depression. And I'm just thinking, oh my goodness, if someone could have detected that earlier, then we wouldn't have such a tragedy. So now I have a 20-year-old son. He doesn't have a grandmother, no auntie, no uncles, nothing, because they were all killed, of course. And his eldest brother is now in prison for the rest of his life. And it was all due to early detection. So here I am adamant that we have to detect, we have to observe, and make sure we give the clients the tools that when they go home, and even the family members, it's a whole support system, right? It starts with the doctor, it starts at home rather. So it starts with the family, then the client, then the doctor, then us. And then of course back into society. But early detection, that is what we preach. Medication compliance, cognitive skills thinking, those are the things that we group to help these people to successfully go back out there. And as for me, I'm rehabilitating myself because it was hard hitting. It was a tragedy of, first of all, it made history in the town in which it took place. And then secondly of all, it left my child already. He didn't have a dad because his dad passed 1 year before. And then now the rest of the family. So it was hard hitting, and I just figured I had to do something. Too many people are dying for no reason. It's just as simple. Something you just keep observing. The person switches a lifestyle real quick. You studied 6 years of law, and all of a sudden you want to be a guitarist. Something is wrong. That's a signal. You know what I mean? So we try to educate the families and let them know what to look for in terms of just any odd behavior.
What has been the response of the Jamaican public towards your ministry here?
Well, like I said, there's a stigma on mental health, and they just believe, oh, it's marijuana. It's always associated with marijuana, but that's not the case. These people had tragedies in their own family. Sometimes it's just a separation of a mom and dad unit, or someone dying that was very close. There's a lot of
variety of things.
Exactly. And there's a lot of ignorance and misconceptions and non-education.
Now, what are some of your biggest needs here presently within this ministry?
Funding, and more funding. That is number one. Secondly, we need resources. We have an agriculture project that helps the clients to work with animals. That needs to be, refreshed. We also have, like on the rehabilitative side of the program, we need more resources to have more activities, in order to continue to do good work. Also on the medical side, we need good psychiatrists. Not saying that there isn't any good, but we want some outside entities who have some new and ideas to help us to build, and just to keep progressing. So there's a lot of needs, resource, financial. We even need a building right now. This building is up for sale, so our future is, you might not see us here next year, we don't really know. But we do have an option to buy the building, but we don't have the funds.
Okay.
Well, I want to thank you so much for allowing us to be here. This has just been a huge blessing for me. I have a passion for these people, and you're just doing a tremendous ministry